If you've attended the breathing sound class, you've seen this movement before. This movement is called the Z-sit. What does it assess? It assesses whether, in the first image, the right hip is performing flexion, abduction, and external rotation. The right leg. Is the left leg doing adduction and internal rotation? Let me ask you a question. Under normal circumstances, does anterior pelvic tilt usually go along with knock knees, X-shaped legs, or bow legs, O-shaped legs? Knock knees, X-shaped legs. So if anterior pelvic tilt is accompanied by X-shaped legs, and if this person's anterior pelvic tilt is due to anterior rotation of the ilium, both sides of the ilium rotating forward, along with the sacrum tilting forward, then this results in X-shaped legs. When the ilium rotates forward, the femur should normally be internally rotated, right? The femur is internally rotated, that's correct. However, if you recall, when we did the test yesterday, the Ober's test was positive on the left leg, but hip abduction was normal, while hip adduction was limited. Generally, with X-shaped legs, there's adduction combined with internal rotation. The leg position looks like this, right? The hip joint is adducted and internally rotated. So if his left side rotates forward like this and also opens outward, it means that the left ilium is anteriorly rotated, which should be accompanied by adduction and internal rotation of the left femur. In other words, his left leg should look like this. So why is it that you can't bring it in, but it's actually easier to move it outward? Is because only one side of the ilium is rotating forward. When the ilium rotates forward, it comes with this kind of issue. If my right ilium is normal and my left side is like this, my left ilium is abducted and externally rotated, then my thigh, my femur, will also abduct and externally rotate. So when I walk forward, my toes will end up pointing like this. In order to walk forward, I have to compensate by turning my toes to face forward, so I end up internally rotating. If my left side is abducted and externally rotated, then below that is my thigh, my femur, which also abducts and externally rotates, causing my toes to point outward. But when I walk, it's impossible for me to have my toes pointing way out to the side because I need to walk in a straight line moving forward. In order to walk forward, I have to turn my toes inward because they naturally point outward. And only by turning them inward can I keep them aligned on a straight path. So when a person's left iliac bone rotates forward and abducts and externally rotates, the femur follows as well. Under normal circumstances, if it follows the iliac bone, it will also abduct and externally rotate. But at this point, in order to walk forward, it has to turn inward. Normally, it's like this. If the iliac bone rotates forward rotation is usually accompanied by, actually, I just said it backwards. Anterior rotation of the ilium is usually accompanied by adduction and internal rotation, right? That's the anterior pelvic tilt. But in order to walk forward, because my toes point inward, I have to compensate by abducting and externally rotating to walk. Originally, it's like this. As long as there's anterior pelvic tilt, it will definitely be accompanied by knock knees. And knock knees mean my thighs are turning inward, which means adduction and internal rotation. But when I walk, I can't have my toes pointing inward. I can't walk that way. So to make my toes face forward, I have to abduct and externally rotate my thighs. So what happens is the iliac bone rotates forward with abduction and external rotation, and the hip joint also abducts and externally rotates. In this situation, when you perform the adduction Ober's test, it won't be able to move inward. In addition, if I usually put more weight on my right leg, as long as I put weight on my right leg, my right pelvis will definitely be higher. Whichever leg bears the weight, that side of the pelvis will be higher. So I end up with my right pelvis higher and my left pelvis lower, my right pelvis rotating backward and my left pelvis relative to the right rotating forward. In other words, my pelvis is making a rightward rotation because most people habitually put their weight on their right leg, mainly because the organs on the right side of the body are generally heavier. So for most people, the pelvis is like this, it rotates to the right. But if the weight is on the right leg, the right side of the pelvis is higher. And at the same time, it rotates backward to the right. So if the entire pelvis rotates like this, and my feet are still standing on the ground, then my right thigh has to rotate inward relative to the pelvis, and my left thigh has to rotate outward relative to the pelvis. So my right thigh and right hip joint are adducted and internally rotated, while my left hip joint is abducted and externally rotated. If that's the case, in this kind of standing posture, it's as if the right side of the pelvis is higher and rotated backward to the right. My right hip joint, relative to my pelvis, is adducted and internally rotated. Meanwhile, my left pelvis has moved forward, so my left hip joint, relative to this pelvis, is abducted and externally rotated. So there are two directions influencing this. One is the anterior rotation of the ilium. When the ilium rotates forward, it will normally be accompanied by adduction and internal rotation. But since I need to move forward while walking, my toes have to point outward. So that results in abduction and external rotation. In addition, my entire pelvis rotates backward to the right. So my right side is adducted and internally rotated, while my left side is abducted and externally rotated. This is how I am able to walk forward. That's why when you test most people, the Ober's test is positive on the left side. This is the reason why this situation occurs. So this movement actually tests two things. One is abduction and external rotation of the right hip joint, and the other is adduction and internal rotation of the left hip joint. Now, on the left side, it's adduction and internal rotation, while on the right side, it's abduction and external rotation. At the same time, it also tests the lateral tilt of your pelvis and the anterior-posterior rotation of your ilium. Now, let me introduce another concept. The internal rotation of your femur is equivalent to the internal rotation of your ilium. When performing the movement, for example, if I actively do the motion, imagine I have a thigh here below, and as I twist my thigh inward, twist in the process, isn't the ilium also moving in this way along with it? Because my muscles and ligaments are attached here, when my femur internally rotates like this, especially when I rotate it inward as far as it can go, and I can't turn it any further, and then I try to force it even more, doesn't it pull the ilium to move in this way? So this is called internal rotation of the ilium. So you can understand it like this. When I do this movement and reach the limit of internal rotation, my ilium is also internally rotating along with it. When my leg externally rotates, when I keep turning it outward like this, at that moment, my ilium is also externally rotating along with it. So in this position, the left leg is adducted and internally rotated, while the right leg is abducted and externally rotated. So what exactly are we testing here? We're testing whether your left ilium can internally rotate and whether your right ilium can externally rotate. For most people, the left ilium is already externally rotated. If you're stuck in that externally rotated position, when you try to do this movement, you won't be able to internally rotate it, just won't go back. So when you can't return, either your right knee will lift up or your left ischium will lift up, which leads to compensation. As for the right side, the ilium is originally in adduction and internal rotation. Now, if I ask you to do abduction and external rotation, but your right side is stuck in adduction and internal rotation, then you simply can't move into abduction and external rotation, so you won't be able to perform this movement. If you can't do this movement, then when you try, either your right knee will lift up or your left ischium will lift up or your entire spine will compensate for it. So this movement tests a lot of things. It checks both your hip joint function and your ilium function. During the breathing festival, I only taught everyone how to lower the ischium, but actually there wasn't much time to explain what this movement is really about. Most people can't lower it like this. If the right thigh is pressed against the mat, the left ischium will lift up, and that's the easier way for most people. Why is it easier this way? Look at this picture and tell me, what kind of movement are his left and right ilium doing right now? The right ilium is internally rotated and the left ilium is externally rotated. Since his left side is already externally rotating, doing it this way is relatively easier for him. What does that mean? It means that when most people do this movement, they'll find it smoother this way and awkward the other way. That's because in the other way, the state of his pelvis, his ilium, is exactly the opposite. So what is considered normal? For a normal person, doing it on both sides feels the same. That means your ilium can both internally and externally rotate, and it can alternate between the two. But there are also some special cases where your sacroiliac joint and your hip joint, along with all the ligaments around them, have become so loose that you can do the movement no matter what. So this is a false negative, which is even harder to deal with than the true positive. All the ligaments around the joint have been stretched loose. So no matter how you test, they can always go down.